care very much about the program and the staff, which is why I've asked to engage in a collaborative process. Because by not allowing me to close this program, which I cannot staff safely, will cause interrupted service and care for patients, which I feel is way more threatening to the health and welfare of the community members than having a consistently staffed service. We are in a healthcare crisis at this moment for staffing globally.
Understood. Understood.
And I do, by not allowing us to collaboratively work with you, you will force us to have to divert at times where we don't have the available services. Not knowing if you have services at the hospital will cause greater safety concerns for the public. By not allowing us to work with our staff to place them in positions and just divert, that is going to cause additional issues for our staff members because you're not allowing us to do this in a collaborative process. But sitting here and just telling me perceptions and not asking me actual questions is part of the problem.
Well, you were asked questions, and I'm asking you questions as well. It is difficult because
those were leading questions. He knows very well that I can't speak about confidential contracts in our contracting process. That was a true statement.
And you're not allowed to tell us who you sent any of those.
No.
Or who you've reached out to.
Am I being videotaped? Seriously?
You're on Zoom.
It's public.
It's a public meeting.
Public meeting. So is it really, by a public person, I'm allowed to be videotaped? I understand the Zoom, but by somebody individually, I'm allowed to be videotaped?
Yeah, actually, technically, we're in a public personal expectation, but I can't hold the wall to you, like, I'm pretty safe as that is. If we could try to keep it being civil, and also we can keep it to questions that she can answer, that'll help us to move forward in our process. So, Cheryl, are you done?
Yeah, I tried my best, and I would have loved to have said that, having been in that department for as long, and everything you speak about diversion and everything